Lauren, I know now, will always be with me, the spirit, but I know that she lives on in somebody else. And the amount of peace I get from that and strength it gives me, knowing that in her end of life, gave life to somebody else.
Welcome to this episode of HSE Talking Health and Wellbeing. My name is Noreen Turley, and today we're talking about organ donation, why it matters, what's changing, and how each of us can make an informed choice. We are joined by two guests. We're joined by Dr. Catherine Motherway. Thank you very much for joining us, Catherine.
Thank you, Noreen.
And Catherine is going to explain what Ireland's new opt-out organ donation system means. And we are thrilled to be here with Olivia Farrell, whose daughter Lauren donated her organs after a sudden passing at 24 years old. And Olivia, I can't thank you enough for being here with us today. Thank you for joining us.
Oh, thank you for asking me. It's lovely to be here.
So the impact of the changes that have come in, Catherine, since the 17th of June, can you just tell us a little bit about that and what is changing to do with organ donation?
So effectively, the Human Tissue Bill or law was enacted on June the 17th. And what that effectively means that now it is presumed in the event that you have died, in circumstances where organ donation is a possibility, which is actually quite rare, that you would have wanted or had no objection to your organs being donated unless you have elected to opt out.
Okay.
So effectively, if you are someone who, for whatever reason, and there are many valid reasons, that doesn't want to be an organ donor, you now have the option and ability to opt out on the opt-out register. You can do it online, you can do it via the HSE Live phone number, which is 1800 700 700, if I remember rightly. And once you put your name on that register, should you be unfortunate enough to die before your time, we will not approach your family about organ donation. That's effectively what the opt-out register has done. For those people who have no objection to organ donation after their death, or for those people who would truly want their organs to be used after their death, the system really hasn't changed in that much, in that we will still be approaching the family of people who have died in these circumstances to ask them what your wishes would have been. So if Catherine Motherway, for the sake of example, is unfortunate enough to die before her time, they will approach my husband, who would be my designated next of kin, if my name is not on the register. But they will check beforehand. So they'll ring up ODTI and say, is Catherine Motherway's name on the opt-out register? And if Catherine's name is on the opt-out register, they will not be talking to my family at that point in time. But if Catherine's name is not on the register, they will then be able to approach my husband and say, Catherine's name isn't on the register. These are the circumstances. What would Catherine, do you think, have wanted in relation to organ donation? Would she have had an objection, or would she have liked to have done this? And then he, presumably, knowing my wishes, I hope, because he does know them, because I've had the conversation as well, you can imagine, given my job, will tell them what I would have wanted. And that's effectively what has happened. So it's called a soft opt-out. If you opt out and you're on the register, your family cannot change your mind. But if you haven't put your name on the register, we will still be checking with your family, like they did with Olivia when Lauren, God bless her, passed away, to see what she would have wanted. Now, that was before this law, and this law doesn't apply to children under the age of 18.
Okay.
It doesn't apply to people who haven't lived in Ireland for longer than a year, and it must apply to people who have sound mind. So this is for adults. So it's very important to know that it doesn't apply to children under the age of 18, but it does apply to all adults who live in this country who are of sound mind and have been resident here for a year.
Okay. So it's very much respecting the opinion of somebody if for whatever reason their family won't be approached them, they made a decision that they don't want, which everybody is entitled to do. Going to you, Olivia, now, and speaking about Lauren, what you decided to do. First of all, tell us a little bit about Lauren. You have a lovely picture of her here today, and I'm so glad you put that up. It's so lovely to see her. You feel like she is with you now when she's here. But just tell us a little bit about it, because it must be still very raw for you.
Oh, Lauren was a great girl from when she was born right through to her very end. She just was life, full of love. She was an only child. So her cousins, her aunts, her uncles, her family, her wider family were her immediate family. So she was loved by absolutely everybody, and she loved them back. yeah, she just was a really good girl, never gave me a day's trouble, thankfully. Can't say that for me when I was growing up, but yeah, she just was, everybody adored her. And, she really was a really good kid, always giving, looking after people, organising family day outs, Even my nephews were just saying that the other day. I brought them out for a walk and they were talking about her, and reminiscing, which was good for them, to have the memories, to know that she's still with them. But that's the way they remember her, as well as being all together as a family unit, But yeah, she done really well in school, went to Maynooth University, got into a really good firm for accountancy. So she was an accountant with that. And she loved the firm, loved the work.
And she went through all the accountancy exams and everything.
Yeah,
she did all of those.
Yeah, so
they're not easy.
No, they're not easy, and it was tough for her, but she still got through it. Yeah, the company were great; they really supported her, and even to this day, they actually have a day for Lauren. On St. Bridget's weekend, they do a day for Lauren that they bring me, my family, and all the team
that's so nice.
out for a walk, and they'll get together and reminiscing. And that goes to show you her spirit, her kindness, the type of individual that she was, that she's even been remembered after the few years, and to still be remembered. Yeah. And they're in contact all the time, So yeah, they're really, really good.
What happened to Lauren? What was the illness that she had? If you don't mind telling us a little bit.
Lauren went out on a night out with the work team and started getting pains in her legs.
Okay.
A couple of days later, put it down to wearing high heels. Never thought anything of it, 24-year-old.
Absolutely.
Sure, getting on with getting stuff organised. And long story short, anyway, she eventually went to the GP. The GP urged her that day to go to the A&E, and she'd busy, she'd stuff to do, so she didn't go for a couple of days later. Brought my mother into the Bord Gosh for a night out, and then the next day she rang my mother and said to Mum, I'm heading off now to the A&E. Do I have to pay for this? This was kind of what she was.
Of course, yeah, 24.
Yeah. Drove herself to the A&E, parked up, and had a sudden heart attack in the car.
In the car?
In the A&E, yeah. Lucky enough, a nurse had spotted her and went over to her and they resuscitated her. But I think at that stage she was 15 minutes gone. So they got her back anyway, got her in, got her up to the ICU, and then we were all contacted. And from that then, things gradually started to deteriorate for her. And that's when the organ transplant team came into us and the doctors spoke to us. And
how did you find that, if you don't mind me asking? Because it must be a difficult conversation for the doctors to have, although I'm sure Catherine will tell us a little bit more about that. But also for you and for the family, it must be very difficult. Yeah. The reality must really hit then.
I think the reality, when they came and they had said to us, that the kidneys were going to failure, then it we kind of started to realise then, okay. And then the doctor came in with all the options. And the last option he came in with was organ retrieval. And it was an immediate answer, yes. There wasn't even a second thought. Oh. Yeah, myself and Lauren's father just said yes, straight away together.
And had you discussed it with Lauren?
No discussion at all with Lauren. Lauren's friend was with us in the hospital, and no, I suppose, kids, they don't talk to you about things, your parents, like, what we know, didn't have any conversation with me. And that was just an immediate reaction from the both of us to say yes. And then from then, the doctor, he was absolutely beautiful. They approached it so compassionately and so kind, because I suppose in a situation you don't know. I mean, you probably know yourself, Dr. Catherine, that you don't know what to say to people. And, for us then the answer was yes. And then it felt right. And then we went out and told our family. And our friend actually said that's what Lauren would have wanted, that they had the conversation, And she did. I found a couple of weeks later an organ donor card in her wallet, her signed.
So you had carried out her
Absolutely,
wishes.
Yeah. Without even having that conversation, she already had it herself. She already knew, in herself, that's what she wanted to do. So for me, then that was just completely.
You knew you'd done the right thing.
Absolutely, 100%, yeah.
And Catherine, is it difficult to have these conversations with families?
Obviously it is. I mean, the more difficult conversation is because this happens at the end of life or after the end of life. So the patient has either died or they're about to die. So you have, usually when you get someone into the ICU, you're obviously trying to fix them. You're trying to return them to health. That's your aim in life. But you've got to the point where you know that you can no longer save this life for the patient. has passed away. That's the really hard conversation because you've usually lived through a period of time with the family.
Trying to get them better and fix them, like you say.
There's sudden events. Sudden things happen. Lauren was living her life on a Monday and then on a Tuesday this happens. So like it's a very sudden event. So you're thrown into the world of the ICU. You're sitting there looking at your loved one. We're trying to fix them, obviously. And then we come to a point where we know we can no longer do that. So the conversation sometimes is gradual, and then you have to have this conversation about the fact you're at the end of life. Now, for me, that's the difficult conversation, and I've never personally had a difficulty with asking about organ donation because it is my very firm view that this is a choice that the patient and the family must make. It's not my choice. So if I don't ask them, they don't get the option. So they must get the option, and they, like Olivia, will know what the patient would have wanted. And that's really important. It doesn't matter the circumstances. Sometimes, it's maybe a younger person, it's a small child, and people are saying, isn't it? And I go, you have to offer them the option, because I think it has to be acknowledged that while organ donation and transplantation is life-saving, and you mentioned life, she was full of life and she gave life at the end of life. It's life-saving, it's life-enhancing, but for the donor families, I do believe that at the time of death and afterwards, I think it brings great comfort. That is my experience with families. I think it brings comfort, pride. Yes, it is really, really difficult. I think I can't say so. Thankfully, I can't say that myself, but I've seen this when working with families. But it gives them a hope in the middle of this absolutely terrible period of time.
The care that Lauren got in the hospital in the ICU was phenomenal. Even before, we were approached when they knew that end of life was very near, and for the doctor to come in and to have such compassion, and it is a sore subject. It is a touchy subject because at that stage you're in a daze, like you're not really in yourself, I suppose is the only way to say it. Your concentration is not with you, it's with your loved one in ICU. But I do believe that if you do make the decision, it's the right decision. If even like myself and Lauren's dad, it was an immediate reaction. I felt it was the right decision. And knowing, Lauren, and I could tell you loads of stories about Lauren and growing up and the way she was, but it's what she would have wanted, I'm lucky enough in that respect to know that by her, and the way she was, and that's what she would have wanted. So,
and when you made that decision, and you were, by the sounds of it, you were sure of the decision from the get-go. What happened then?
Well, then we went out, we told our family, and then I think what happened then was that they went in and they told the organ transplant team. They were probably already in contact with them. And then a couple of hours later, we were approached by the lady from the organ donor team. She came in, organ transplant team, sorry. She came in and she sat down and she spoke through everything with us. The whole process was absolutely fabulous, even put us at ease. The calmness that even came over us then kind of was okay. You kind of felt okay with it. You knew it was the right decision. And then I think for me personally, that knowing that Lauren was going down into her arms, into her team, and the care and the love that she was going to receive that night, I knew then it was the right thing to do. And you're literally just, handing your child over, Yeah. So, yeah, no, it was the right thing to do. And the conversation, it's a hard conversation, but it's a conversation that needs to be had, because at the end of the day, from Lauren's life, she has given a life to somebody else, and that's, if people understand that little bit.
And has that helped you?
Tremendously.
I'm not sure where you can get the comfort of your 24-year-old daughter dying so suddenly, but if there is some comfort.
Oh, massive comfort in it, and knowing it's what she would have wanted. That's kind of really, and then knowing that there's another person out there living their life, they've got their life back. The individual actually approached us and sent a letter, and a beautiful letter, and even to receive that letter was just an honor from them, alone to know that, they explained their situation and explained how they were and how they are now, and their life has completely changed. They've got their life back,
And Dr. Motherway, the impact that receiving an organ can have on somebody's life is incredible in quite a short space of time.
Oh, absolutely. Yeah. I mean, most of our patients on the waiting list for transplantations are dialysis patients who are waiting for a kidney transplant. And the life-enhancing effect of that on patients is huge. They no longer have to have dietary restrictions. They can go back to work. They can get a mortgage. They can actually have kids. I mean, I can remember a few years ago I was speaking at some meeting and one of my nephrology colleagues said he had a transplant patient who just had twins. She would never have been able to get pregnant if she hadn't had a kidney transplant. I have a relative who's had a kidney transplant who has had, at this stage now, almost 30 years of life as a result of that transplant. So it is huge. And obviously for patients who have lung or heart failure, they can't breathe.
Yeah.
They cannot breathe without oxygen. They can't move. Some of them are sitting in hospital awaiting transplantation. And it's life-saving for our liver patients. It's enormously beneficial to them. Like we have, I think at this point in time, since transplantation started in Ireland, at least over 7,000 patients have received a transplant from net $3,000. It is, in this world of ours at the moment, which is quite unhappy, it is an enormous ray of light in terms of what people can do for other people. And the people who do it are the donors, both living and deceased. But for the deceased donors, it's their families do it on their behalf. And it is an unbelievable gift. But it is really good, I think, for the families to know. Now, you knew what Lauren wanted. Some people don't. So, and it is very helpful if they know what you would have wanted, because they're going to be thrown into this morass of emotion, of grief. And it does help, I think, if you've had the conversation.
So have those conversations.
Have the conversation. And it doesn't have to be deep and meaningful. Like, you can put it on your driving license, but you wouldn't necessarily go looking at a driving license in the middle of this. You don't necessarily go looking through wallets. So having the conversation helps. Obviously, having it on your driving license or having it anywhere is good, but it is really useful if you have the conversation with your family, your next of kin, people that would know you and then they can speak on your behalf.
Yeah.
At the end of life,
Absolutely.
if you're unlucky enough to have this happen to you.
Lauren didn't have the conversation with us as the parents, but she had the conversation with her friend, and to even hear that and know that.
Yeah, that she had mentioned it.
That she had mentioned it, probably flippantly,
Or maybe when they were signing up for their driving licence or something.
Something very simple and but it still came into their minds and they were thinking about it. And that's kind of what made me realise as well it was the right decision. And from that conversation and her having that, I mean, I've spoken to all my family. My family now know my wishes. I carry my donor card. I'm online. I've it all, everything ticked the way it should be ticked, So, and even my wider community all kind of are just all signed up for it now because they do believe in it. Like, they've seen, they all knew Lauren, they all knew the gift that she's given, and they can understand as well that, in a point of tragedy, there is something good to come out of it. And as you're saying, Dr. Catherine, our world it's not very good at the moment, but if we can give back some way in some goodness, to save somebody else,
And the strength that you have, Olivia, is unbelievable, really. You're keeping Lauren's memory alive as well by having these conversations. And I think you mentioned before that there's maybe other opportunities for Lauren to donate as well.
Yeah, so Lauren donated her liver. It was her liver that she went down to theatre that night and the individual received the next day. But she also donated her heart valves. So I think they go into
So for heart valves, they're stored obviously and will be used subsequently, often in surgery in adults, but frequently in surgery in children. And it is possible that you will get a letter sometime in the future telling you that her heart valves have been given somebody a new lease of life.
Yeah, I do believe that will happen, yeah. Yeah, I really do.
That can happen for, I think it's up to 5 years.
Yeah. And Catherine, it's not everybody who can donate their organs.
No.
Like it's a small percentage.
It's a small percentage of people. So you have to be unfortunate enough to have something sudden happen to you. you have to die before your time. Now, that said, you can donate organs up into your 70s. So don't ever presume that you're too old.
Okay. That's important to know.
It is important to know for people. I'm over 60 and I think if God forbid something should happen to me, I'd be perfectly good for quite a number of organs. I hope, if they'd have me. Also, you shouldn't assume that you can't do so. You have to die in sudden circumstances. You have to be in an intensive care unit.
Yes.
We have 30,000 deaths in Ireland, but not that many of them occur in ICUs.
Yes.
Obviously, there are some things that will prevent you. But in the past, you couldn't donate if you had hepatitis C. Now you can. You couldn't donate if you had hepatitis B. Now you can. We've made huge progress. So we can offer the opportunity to more families now in the circumstances where it's appropriate. But it's less than 1% of deaths that you can.
And Catherine, what misconceptions do people, I mean, you've been an ICU consultant. There must be misconceptions that people have about organ donation. And is there anything that we should clarify for people?
Well, I've clarified the age issue. Don't make an assumption about your age. Don't make an assumption because you have a specific disease that you can't do it. If you would like to try and offer your organs after death, if you in those circumstances, make absolutely no assumptions. Just tell your family, and then we can check. Mm-hmm. Sometimes we can check. We can have somebody in the ICU who's at the end of life and the family may inquire about organ donation, or we may have a query ourselves, and we can check with the teams if it's possible. Mm. I mean, obviously an active disseminated malignancy would be a very big problem in donation. We probably can't in those circumstances. But maybe if you had something 20 years ago, that might not necessarily prevent you. So we can check with the transplant teams what organs you could offer in those circumstances. So we would say that if you have a query about a potential donor, or if a family have a query about offering this gift of life to somebody else, ring Organ Donation Transplant Ireland. We can check with the transplant teams to see if it's possible. And if it's possible, we will do our utmost to achieve it. And if we can't find a recipient in Ireland, we'll try and find one in either the United Kingdom or Europe. We can actually share organs across borders still. And that also means that, like, our liver patients, super urgent liver patients, would have access to the donor pool in the United Kingdom because we have a very close relationship between our transplant services. For years, our patients went to England to get lungs, so there's a relationship there, and all our children go to the United Kingdom to get organs. So we have a very close relationship with the United Kingdom, and we also have a close relationship with Europe. So we try and let families who wish to offer this gift, we do our utmost to make sure that we can achieve it. Now, we can't always, but we do our best to do that. So the other misconception, I think, for families, there's no doubt it adds time at the end of life. It does add at some time. So it does take a bit of time to organise. So it'll definitely add a period of time, a minimum of about 12 hours, but up to a day.
Okay, so that means you have to keep the person alive.
You have to continue supporting have to continue supporting the donor organs. And then you will, set a time that suits, number one, the family.
Yeah.
Number two, the hospital. And number three, the transplant team. So you set an appropriate time for the gift to be given to somebody else. So it does take time. And the other thing that I think people sometimes are afraid of is that it will interfere with funerals. It doesn't. Mm. This is basically an operation, and it does not in any way, shape or form interfere with your ability to have whatever funeral service it is that you would like. None of the major religions have any problem with organ donation. There is no particular religious group that have a problem with organ donation. Organ donation is supported, in my experience, very much by our coronial system. And often these people who die before their time, the coroner is often involved in the death. And in the investigation afterwards, which is often accidents and stuff like that. So sometimes we will need coronial consent, but it is absolutely almost always given. So it's those are some of the misconceptions that people might have. So from the staff's point of view, you must offer the opportunity. Some people I think that we're asking for something, and I think we're offering them an opportunity. Mm. It's an opportunity.
That's a good way to look at it.
Yeah, I 100% agree with that. Yeah.
And yes, you are asking for a gift, but sometimes giving a gift gives benefits.
Yeah.
Do you know?
Tremendous benefits.
Yeah. And so, Olivia, on that, what would you say to families that are listening that may be in this situation at some stage? Because you never know. You didn't know when Lauren was going to the A&E that day.
No,
you didn't know that was going to happen. So what would you say to families who do find themselves in this situation?
Trust your heart, trust your gut, because I do feel your initial reaction is the right one, whether it be a yes or a no, because not everybody would be, I suppose, as strong as I would have been or Lauren's dad would have been in that situation, because we knew her so well, being an only child, and we knew the type of individual she was. But I think not be afraid of it, not be afraid. Maybe if you're asked the question, maybe ask for a little bit of time to maybe step out, take a little bit of a breather, kind of weigh it all up and say, right, okay, well, do we feel this is what they would have wanted? Maybe even go through their bits of belongings or whatever, take a bit of time. You don't have to answer that question. It's just, it's for me, personally, Lauren is living on in another person, to know that for me, that's going to be with me forever. And,
of course.
If people can even get a sense of that, knowing that they will live on, maybe take that little bit of time, have a little bit of a breather, and then make the decision. But don't make the hasty decision that we could turn around and say, oh my God, why did I make that? That was either was right or wrong, so take a little bit of time. It doesn't have to be very long, but, because the time is there, because as Dr. Catherine said, I mean, we got extra hours with Lauren that we probably wouldn't have got,
I know. And that's precious.
Yeah, and the care that she got within those extra hours, even more so when they found out that she was going to give the gift of life, was just blew me away. I would be forever grateful to the hospital for the care that Lauren got at her end of life,
So, Olivia, your daughter's leaving a strong legacy, really.
In terms of legacy, I doing as much promotion for organ donation as I can and get the word out. And that conversation, I feel it needs to be had in all families, and not be afraid, because we are at the end of life, regardless of where we are, we don't have the conversation without anything about. And it's a pity, really, but it's something that we could hopefully change over the next few years anyway.
In terms of people wondering what to do in relation to the current act and whether they wonder what to do. Obviously, if you have a strong view that you don't wish to be a donor, then you can opt out. Just be aware that nobody can change your mind. The only person who can change your mind is you, and you can only do that in life. If you wish to change your mind, you can do so at any point. You can opt out of it, you can actually, there is a change your mind button.
Yes.
But if you do that, that is your final choice. That's wonderful. It's perfectly good that you have this opportunity. But if you're not sure what to do, and if you're wondering whether to opt out or not to opt out, if you have a doubt about organ donation, maybe you could talk to your family. Maybe you could talk to your GP. Maybe you could talk to a family who, like yourself, Olivia, who did have a family member who donated organs. Or you could talk to an organ transplant recipient. That might help you decide what you want to do if you have a doubt about organ donation.
And Catherine, you can signpost people to those. Where should people go to
HSE website,
the
Citizen Information website, the Strange Boat Foundation, which is run by Martina Goggin and her husband Dennis in Galway. And they also are in charge of the Garden of Life, which is a garden in Galway, in Salt Hill, that is donated and that is actually run to remember and honour organ donors.
Very peaceful.
You've been there, Olivia. Oh, yeah. I have never been there, actually. I must visit
absolutely
it.
Beautiful.
So it's in Galway and it's
in Salt Hill,
yeah. Lovely.
Absolutely beautiful. Very peaceful.
It's in the Quincentennial Park,
I
think.
Yeah.
And
you can really feel,
you
can just feel it so peacefully.
And Salt Hill is such a busy place.
Yeah.
And you almost pass this without knowing it's there.
Yeah, it's beautiful.
But Martina and Dennis are enormous spokespeople for organ donation. Their son donated organs some years back. And they are two wonderful human beings that work with the organ donation community. They run the garden, and it's a lovely place to go. For the family, particularly for the families of organ donors, for people who work in organ donation, and many recipients go there too.
And there's a mass every year there as well.
Yeah, they have a ceremony there every year.
Perfect. So that's a lovely place to go to gather.
Yeah.
And then you meet other families and
well, this
stuff.
is it. Yeah, you like, people with the
donation.
same like happenings, I suppose, in their lives as well.
We've gone through similar things that you have.
And recipients as well.
Yes.
Yeah. So it's very peaceful. It's lovely.
So they're the place to go for information. The Irish Kidney Association have been promoting organ donation for many, many years. They run a service of remembrance every year and all of the donor families get invited and many recipients will also attend. Now, at this stage, the community is getting very large and they had to scale it back during COVID, but they've continued to support organ donation over the years. So these are all places that you can go for information if you are a little unsure. Now, we know that between 80 and 90% of us are fairly happy to have our organs donated after death if we are unfortunate enough to die before our times. We also know that you're far more likely to need an organ than you are to give one. But I can't emphasize enough how beneficial it is for your family to know what you would have wanted if they are in the unfortunate position to be sitting next to you in an ICU, wondering what to do. If they know what you want to do, it does help. And there is absolutely no doubt of the benefit it gives to the recipients as well.
Yeah.
It's tremendous.
And I suppose we're coming to the end of our podcast, so just to let you, Olivia, give the last word to Lauren, really, and how by you donating or given permission to donate Lauren's organs, the difference that it's made to you and how you would like Lauren, I suppose, to be remembered, really.
Lauren, I know now, will always be with me, the spirit, but I know that she lives on in somebody else. And the amount of peace I get from that, and strength it gives me, knowing that, from her tragedy, which it was a tragedy very quickly, that she, the human that she always was, the young, jolly, happy kid growing up, kind, loving, generous, in her end of life, gave life to somebody else. It gives me strength to go every day, keep going every day, and will continue to, so yeah, to me, she lives on with me every day, but certainly lives on in the strength in somebody else. And the gift of life is really and truly, there's no words can describe, how comforting it is to know that she did that.
Oh, thank you so much. And thank you for bringing in her picture as well.
I think
it makes the realisation and the impact that Lauren has had. So thank you so much. And thank you for all the work that you've been doing.
Oh, you're very welcome.
For this, because it's just incredible. And you explain it with such humility and just in such a humble way. And when it's really such a major thing that you've done. So thank you so much. So, Dr. Motherway, thank you also for helping us understand this whole process and the complexities around it, because it isn't an easy one for anybody, really, for the staff, for the recipient, for the donor. It's quite complex, but then you explained it so simply. So I think that made it much more clearer for us. So thank you so much for that. So that brings us to the end of this episode of our HSE Talking Health and Wellbeing podcast. Olivia, thank you for sharing Lauren's story so generously with us. You've helped to remind us that behind every donor is a life lived. Dr. Motherway, thank you for helping us understand the changes in law and how people can make an informed choice. If you're listening today and want to find out more, register your choice, visit the HSE website. You can call 1-800-700-700. If you'd like to contact us in relation to our podcast, please contact us on health and wellbeing communications@hse.ie. Thank you for listening.